Okay, you just had a baby and you're breastfeeding and you have no idea how to tell that they're getting enough milk. My name's Ashlee, I'm a lactation consultant, and I'm here to help you understand all things breastfeeding. Holy shit, that's a big house. I want you to look for these 3 things. Can you hear swallows? And when I say swallows, I don't mean like gulp, gulp, gulp. I mean like p. It's a very, very faint sound. If you hear that every 2 to 3 sucks, your baby's still eating, they're getting enough milk. If your baby's swallowing every like 6 to 7 sucks, 6 to 10 sucks, they're mostly sleeping. It's time to start feeding again. It's time to wake them up. Second thing is wet and dirty diapers. Is your baby peeing and pooping the appropriate amount? This is a narrow road. Babies should be peeing and pooping every day. Now, when you're in like the 2 to 4 week range, you want a baby to be pooping multiple times a day. Sometimes when we get to about 6 weeks, we're pooping maybe once a day. Number 3, are they gaining weight? Now this is very different for the first 4 days, because if you know anything about newborns, you know they actually lose weight in the first 4 days. But their weight should be like a check mark. It should go down and then come back up. Now, they should not lose more than 10% of their birth weight. If they do, that's a red flag, and they're not getting enough. Usually by day 4 of baby's life, your milk should be transitioning from colostrum to mature milk, which means that baby should stop losing weight and start gaining weight, hence the check mark. Doing a weighted feed can be really helpful because it shows you how much baby's getting, but it only shows you a small snapshot in 1 day of your baby's life and 1 feed of your baby's life. So it doesn't really show you a whole lot, but it does give us a good idea of, okay, this is generally how a feed goes. Do not do a weighted feed at home. The hatch scales and the scales that you buy from the store, even at the pediatrician, their scales are not accurate enough to do a weighted feed. Lactation consultants generally have scales that are accurate to 2 to 5 grams, which means that you're getting a pretty good idea of how much baby's getting, down to like 2 milliliters. I just want to also say, the first day of your baby's life, they're going to be so sleepy. They're recovering from birth. You're recovering from birth. There's going to be a lot of pressure to get 8 feeds in 24 hours, and it's going to be hard because babies don't want to wake up to eat in the first 24 hours. And in the second 24 hours, you're going to be like, whoa, this is a whole different baby. They want to eat all the time. That's because they've realized now they're separate from you. That's why second night syndrome tends to be a thing. That's actually one of the most common times that I found when I was working in the hospital that parents asked for supplementation because they thought their baby wasn't getting enough. In reality, they're just being completely normal newborns. And usually by the 3rd or 4th day, you're transitioned home, so you're kind of like lost in the sauce because you don't have the support that you had in the hospital from the nurses and the lactation consultants to show you how to latch and tell you your baby's getting enough and like monitor weights. And then sometimes what happens is your baby is struggling to gain weight or is kind of plateaued, and you have to go back to the pediatrician for weight checks multiple times, because their job is to make sure that your baby's healthy and gaining enough weight. And if you don't have a solid plan in place, what happens is the pediatricians tend to go ahead and give you a plan, and sometimes that involves, okay, go ahead and give some formula until your milk comes in, because they just don't really, like a lot of pediatricians just don't have the background knowledge to tell you what to do while you're supplementing. And what happens is babies don't get fed at the breast and moms don't pump, and their milk really doesn't come in. It really doesn't transition from colostrum and doesn't come in as voluminous as it would have if you were removing milk constantly. And then their supply goes down, and then they're in this rut of, you know, we're giving 80% formula, 20% breast milk, and then it just kind of withers away to nothing. And it's unfortunate because these professionals need to send parents to professionals who understand the anatomy of the breast and how milk removal works and how to increase breast milk supply and just all of the things, all of the nuances that come with breastfeeding an infant. If you really want a pro tip, the thing that I suggest is, if you are not high risk and if your OB or your midwife says it's okay, at 36 weeks pregnant, you can actually start hand expressing and collecting colostrum, which is really ideal if your baby has to be supplemented after they're born, if they have low blood sugar, if they have to go to the NICU, if you're having a hard time expressing after delivery. That's a really good way to give your baby what they need without having the stress of, oh my gosh, I just had a baby and I don't know how to do this. But again, make sure you clear that with your healthcare provider, your IBCLC, or your OB or your midwife.